Hello friends, in this video we are going to start the new topic on the antifungal drugs. So antifungal drugs are used to treat the fungus infection. So in this video I am going to discuss the fungus cell wall, and after that drugs which used for the fungus infection. So suppose that this is the cell of the fungus. This is the fungus cell. This is the fungus cell. Fungus cell having the two layers. This is the first layer. This first layer is known as the cell membrane. This is the first layer is the cell membrane. Cell membrane of the fungus. And after that second layer. This one is the second layer of the fungus cell. This second layer is known as the cell wall. Fungus cell having the two layers. First one is a cell membrane and second one is a cell wall. So first we will discuss about the cell wall. After that we will discuss about the cell membrane of the fungus. Cell wall of the fungus is made with the three components. First one is the chitins, and second one is a protein, and third one is the beta glycan. So these three components make the cell wall, and after that come to the cell membrane. Cell membrane is made with the one important component that is known as the ergosterol. Ergosterol. Suppose that this is the ergosterol which making the cell membrane of the fungus. So let's discuss how these ergosterol is synthesized. Here is a squalene that's converted into the squalene epoxide in presence of the enzyme squalene epoxidase, and after that that's converted into the lanesterol, and lanesterol converted into the ergosterol in presence of the enzyme 14 alpha D methylase. So that enzyme help to convert the lanesterol into the ergosterol, which is the important component of the cell membrane. Look this structure. This part is a cell wall of the fungus, and this part is a cell membrane of the fungus. So come inside. So mainly drugs bind on the cell membrane of the fungus, and some of them bind with the cell wall of the fungus and some cell membrane of the fungus. So come inside the cell. Here is the enzyme, RNA synthase enzyme. RNA synthase enzyme that synthesize the RNA, which is important for the synthesis of the protein, and in it also having the centrioles. It also having the centrioles, which having the hair-like structures. These structures called the microtubules. These hair-like structures called the microtubules. So after that we are going to discuss the mechanism of action of the antifungal drugs according to their classification. So first of all, first class drug is the Pauline. Paulines means that drug, that compound having the double bonds. So that is called the Pauline. Example of the Pauline is the amphotericin B, nystatin, and the hamicin. Site of action of the Pauline class drug is the membrane. They act on the membrane. And mechanism of action, bind with the ergosterol and form a pore in the membrane. So these, like that, suppose the amphotericin B, which is the Pauline class drug. Amphotericin B bind with the ergosterol, which is the component of the cell membrane. So this amphotericin B bind with the ergosterol and make a pore formation. Look this structure, this red one. This is a pore formed by the amphotericin B bind with the ergosterol. They make a pore formation. Through this pore there is a leakage of the substance like ions. Through this pores, leakage of the substance from the intracellular to the extracellular of the cell. So due to that reason, cell will be subsequently death. And come to the next drug, anti-metabolite. Example of the anti-metabolite is a 5-flucytosine, and their site of action is the nucleus. They act on the nucleus. So they act on the nucleus, inhibit the nucleic acid synthesis. They inhibit the nucleic acid synthesis. These drugs 5-flucytosine inhibit the nucleic acid synthesis. And come to the next class drug, heterocyclic benzofuran. These drug class, example of the heterocyclic benzofuran is the gracefulvin. These drugs site of action is a nucleus, and the mechanism of action of that drug is a disrupt the microtubules function by binding to spindles. So let's discuss about the gracefulvin. Gracefulvin inhibitor of the microtubules. They inhibit the microtubules, so that's why there will be these fungus cell will not divide. They inhibit the cell division mitosis. So due to that reason, fungus cell will be not divide. So after that, come to the next drug, azoles. Azoles is important drug in comparison to all other antifungal drug. Azole is the very important because it show better effect in comparison to other antifungal drugs. So azoles having the two subcategories. First one is a triazole. And second one is a imidazole. Triazole class, example of the triazole is a fluconazole, itraconazole, variconazole, posaconazole, and the terconazole. And imidazole example is the ketoconazole, clotrimazole, and the metronazole. And site of action of the azoles is the membrane. They act on the membrane. They inhibit the 14-alpha demethylase enzyme. They inhibit the 14-alpha demethylase enzyme, which helping the convert of the lanestrol into the ergostrol, which is the main component of the cell membrane, ergostrol. So these 14-alpha demethylase enzyme help to convert the lanestrol into the ergostrol. So these azoles drug bind with that enzyme, 14-alpha demethylase enzyme. These drugs, azoles drug bind with the 14-alpha demethylase enzyme and inhibit the conversion of the lanestrol into the ergostrol, which is the important component of the cell membrane. So come to the next drug, echinocandins. So example of the echinocandins is the caspofungin and the micafungin and the anidulafungin. Site of action is a cell wall. These drugs act on the cell wall of the fungus. They inhibit the mechanism of action is the inhibit the beta-1,3 glycan. So here on the cell membrane having one enzyme, name of this enzyme is the beta glucan synthase. This enzyme is responsible for the synthesis of the beta glucan, which is the important component of the cell membrane. They make the cell membrane of the fungus. So these drugs, echinocandins, inhibit the beta glucan synthase enzyme. They inhibit this enzyme, and therefore there will be no synthesis of the beta glucan. So they inhibit the beta glucan synthase enzyme. They act on the cell wall. And after that come to the next drug, means these drugs. Example of these, terbinafine, butanafine, and the naphthepine. They act site of action is on the membrane. They act on the membrane. They inhibit the squalene epoxidase. So let's see here. There is a squalene which is convert into the squalene epoxidase, and after that convert into lanestrol and may form the ergostrol, which is the important component of the cell membrane. So these drugs, like example terbinafine. This is the terbinafine drug which inhibit the conversion of the squalene into the squalene epoxidase. There is an enzyme which help to convert the squalene into the squalene epoxidase. Name of that enzyme is the squalene epoxidase enzyme. Squalene epoxidase enzyme which convert the squalene into the squalene epoxidase. So these drugs, terbinafine, this drug inhibit that enzyme and stop the conversion of the squalene into the squalene epoxide. That's name of that enzyme is the squalene epoxidase. So we will discuss about the mechanism of action and the classification of the ducts and the structure of the fungus cell, uh, about their cell wall and the cell membrane. So if you like this video, please hit like, subscribe my channel.